So today I'm going to speak about living well with low vision and IRD. So before I begin, I would like to acknowledge the traditional owners of the land on which we meet today, the Wurundjeri people of the Kulin Nation, and pay my respects to the elders past and present. On the slide, you'll see a beautiful piece of Aboriginal artwork by Holly McLennan Brown, and she's a proud Yorta Yorta woman and a contemporary Aboriginal artist. So, inherited retinal diseases affect an estimated 19,000 Australians, as you've probably learnt today, with prevalence rates of about 1 in 1,380 people. IRD diseases is the leading cause of blindness in working age Australians, and the second leading cause of blindness in children. And more generally, there are about 450,000 Australians who are blind or have low vision that can't be corrected by glasses or medical procedures alone. And this number is set to rise to exceed 1 million by 2050. So today I'd like to talk about how we can work together to dramatically enhance the outcomes for patients who are impacted by low vision and IRD. So I'm going to share just a few things before I share about what Vision Australia can do to help in this space. So in Australia, it actually takes an adult an average of 5 years to seek support for vision loss, which is quite a lot when you think about that. So sometimes this can be driven by a fear of confronting a diagnosis of vision loss, but in many cases, it's simply not knowing who to turn to and when. And even people who are born with congenital blindness or experience a rapid loss in vision will often make do because they haven't been given the right tools or information. And it's estimated that just 20% of all eligible Australians with low vision currently receive support services. 31% of patients are currently aware of low vision rehab and support services available to them. So still really, really low. So there's a lot of people out there that they don't know the information, they don't know the support services that are out there that obviously could benefit to help them live well with vision loss. And we know that people who are blind or have low vision, they face a significant risk of injury, depression, loss of income, and social isolation. We know that the longer they wait to seek support, that the higher this risk becomes, and so does the social isolation. So how can Vision Australia help? So Vision Australia, if you don't know, is the leading national provider of personalised technology, services and information for anyone that is experiencing or supporting those with a vision loss. Our mission is to empower a lifetime of independence so Australians who are blind or have low vision can live the life they choose. No matter what age or stage of life, they can receive tailored, individualised support that works towards improving social inclusion and quality of life. We teach people how they can make the most of their remaining sight and rely on their other senses, such as touch or hearing. We can also help adapt the home environment and keep people safe and independently mobile, which is really important. Vision Australia supports thousands of people every year, ranging from our youngest clients learning early life skills to helping older Australians remain independent in their own home. We also see many people who have experienced sudden vision loss from injury or illness. So everyone, and that's our mission, everyone receives support tailored to their own vision condition, their stage of life, and also their personal goals, because we recognise that everyone's different, we're all at different stages. Okay, so what does this include? We have mobility specialists for getting around safely. We have occupational therapists for adapting living environments and building skills and strengths using other senses or prior memory. And you may have met our Seeing Eye Dogs, and we've got a few people here with Seeing Eye Dogs. So they help to enhance safety and navigation with the freedom to move around and through the community independently. We have mental health checks and support groups to connect with others and to manage the emotional toll of being diagnosed with a vision limiting condition. We have orthoptists to assess visual function, make the best use of your remaining sight and prescribe visual aids. We also have education and employment support to enhance social inclusion and help people achieve their long-term goals. So we believe that every individual has the right to meaningful employment. With decades of experience and a deep understanding of working with vision loss, we offer expertise in employment and vision-specific services, access to the latest assistive technology, tailored support that balances life skills, wellbeing and career development. We can connect our clients with programs like Job Access and Work Assist. We can assist with preparation, job search and workplace adjustments. Additionally, we have Braille training courses for adults that are age 18 and above, because we know that knowing how to read by touch ensures people have better access to information, an increased sense of independence, and a lot more professional opportunities. So we have technology, aids and equipment from the Vision Store to keep people connected and enjoying the things they love. And you guys would have seen the Vision Store. It's been operating since 9:30 and it will finish up at around 3:30. So please check it out. Have a chat to our Vision Store staff and, you know, maybe come back another day if you want to explore more. So there is also life skills for children and teens through Vision Australia's Life Ready program, which is designed to encourage and support childhood development and the education of children and young people who are blind or have low vision. There are 3 stages to this program: early years, primary years, and high school and beyond. And they all work to support the individual to form strong foundations for life, true meaningful participation, and lifelong employment. We also have audiobooks and library for leisure and learning, and this is through the Vision Australia Library. So members have access to audio and braille books, newspapers and magazines and podcasts. Vision Australia Library membership is actually free for people who are blind, have low vision, or live with a print disability. There's a Felix Library, and this is for children aged 0 to 7 years old. It's a free service and it's available across Australia. It supports literacy development and enables the children to enjoy tactile stories with their parents and siblings and to learn about Braille. We also have a children and youth library, which features a range of books, resources and services for young people who are blind, have low vision or a print disability. There's thousands of children's and young adult titles available in audiobooks, print Braille picture books, paper Braille books and e-Braille books. And these Braille books can actually be posted free of charge across Australia. Vision, this one I thought of when we were talking about the research papers, I think, and I thought this would be interesting to share. So Vision Australia Library members can also request up to 360 print pages of personal information per financial year to be converted to their preferred accessible format, such as large print, e-text, Braille, and audio. So I thought of that. I thought, we could convert some of these research papers into these accessible formats, I thought. So I can certainly inquire about that with our print, with our team that does that work. So additionally, there is also the Vision Australia Radio, which offers a range of interesting and informative programs, including readings from newspapers and magazines, books, and interviews and specialist programs. There's helpful information for clients and, next slide, sorry. There's helpful information for clients and families. There's life hack resources and self-advocacy resources. So our website's actually quite informative. So check it out if you haven't as yet. There's a developed resource guide for families and supporters that has useful information about funding and about how to ways to adapt the inside and outside of your home. We've got podcast series, and there's a new series called Hindsight currently that dives into the personal journeys of family members and supporters of people living with vision loss. There's also webinars that you can join and access, and website sort of interesting topics like learn how to code through gaming. So it aims to reach all ages. We also have expert support to manage and apply for funding from the NDIS or My Aged Care. All right, so that was quite a lot of information. Please reach out if you want a rehash of all that information and the services that we support. But now I'd like to share with you a clip about one of our clients from Vision Australia. His name is Rolf, and he's just going to describe his life before and after a diagnosis of a vision limiting condition.
It was a long journey for me to get back into society. It was a chance meeting at Centrelink that I got a number of an organisation that I'm lucky enough to work for now, and that's when my journey back to life started, when I realised there were other people in the world like me. Work right now for me is everything to me. There was a long time there that I wasn't able to be employed, and now I've got a job that I truly do love. I have a seeing eye dog that helps me travel on trains, planes, taxis, wherever I need to go. One of the most important things that I think I can say to somebody else that may be going through what I'm going through is don't give up. I literally did. I'm getting a bit emotional now. I literally did, but it was a chance meeting that got me out of my darkness and back into the light. Don't give up. There are other people out there, and there's a lot of people out there that it's able to support.
Thank you. Anyway, so his story is a great example of why early intervention from healthcare professionals is really important. So despite having seen an optometrist and getting a referral, a formal diagnosis of his condition from his specialist, Rolf actually didn't realise there was support out there for about 3 years. So he just spent all this time, I guess, grieving his vision loss and just trying to cope by himself. And you heard how he really fell into deep sort of depths of depression during that time. So until he instantly came across someone from Centrelink who sent him to Vision Australia. So that's how his life started to change. So I guess it's a reminder to not to assume that people know where to go for support, even if they've been living with vision loss for a long time. Introducing support options will not only reduce the risk of injury and distress, but also put patients on the right path to living well with low vision and IRD. Okay, so we need help to identify patients sooner. So if a patient receives a diagnosis of low vision or blindness, or a condition that will result in vision loss, they should be referred to Vision Australia to discuss their options and prepare an individually tailored program of support and services. Visual acuity doesn't need to be below 612 for a patient to benefit from low vision support. Our services are designed to support people when their visual function starts to impact and interfere with their daily life. Okay, so when should you discuss early intervention and support? Well, I guess we've learnt today that with low vision, it can be complex, and all the symptoms that you get from all the various IRDs, and there's a lot out there, it varies and everyone's at different stages, and you could have had RP for this many years, but your symptom could be completely different to someone that you know that has RP for the same number of years. You know, it's just all so different. But we know that they can interfere, all of these symptoms can interfere with everyday activities, such as cooking or watching TV, recognising faces and getting around safely. And in children, these factors may prevent them from achieving their milestones or thriving in learning environments. So if any patient is finding daily activities challenging or they are at risk of injury, such as falls or burns, putting them in touch with Vision Australia is probably the best step forward to set them on the right path to living well. Oh, right. So there are vision stores all around Australia. Health professionals can just direct their patient to the vision store for technology and advice. There's no need for a referral or appointment. If you're going to the vision store, people can just also browse our range online. Our website, as I've shared before, has plenty of helpful tips and life hacks to improve the use of functional vision. So if I can just share a stat with you, according to the Centre for Eye Research Australia's Clear Insight report, compared to people who are fully sighted, older Australians with low vision have twice the risk and likelihood of falling, a threefold increase in the case of depression, between 4 and 8 times the number of hip fractures, and a higher resilience on full-time care, with healthy and independent ageing less likely. So on average, people with low vision will lose their ability to live at home independently 3 years earlier, requiring full-time aged care. Right, so how do we refer to Vision Australia? So there's our Vision Australia website form, or there's the Oculo, which is a secure referral platform. So referrers can use a form on Vision Australia's website, or they can just access this platform called Oculo, which is a simple referral process. So this Oculo platform is quite widely used now, and it's preferred by the optometrists, orthoptists, and ophthalmologists. Or you can refer via our website. We've got a straightforward referral form on the Vision Australia website at visionaustralia.org. You can use this. This can be used by any supporting health professional, or patients and their families can actually self-refer using this form as well. So you just go onto the website and press refer to a patient to Vision Australia, and then the website form comes in and you just populate the fields. And what will happen is when you submit that form, you will get a welcome email. And then this sets an expectation of, okay, I've got 1 minute remaining, so I'm just going to go really quick. So the expectation of when you'll hear from us, and there's also a hotline number that is provided. Then you get a phone call from Vision Australia within 5 to 7 business days, where we call you up and we find out about your goals, we learn about you, and we put you on the right track to finding out what sort of funding you might be able to apply to get access to our services. So I just wanted to run through a few frequently asked questions. The first one is, do you need a referral? Answer is no. If a diagnosis is known already, you don't need a referral. You can just self-refer. If we need to find extra information about your eye condition, we can always reach out to your ophthalmologist. Question number 2. So how can my patient attend appointments if they can't travel independently? So we have metro and regional locations. Usually our sites have good access to public transport and taxi services, and sometimes we can do telehealth services for mental health appointments, and sometimes some of our service providers can travel to the patient's home if appropriate. Frequently asked question number 3, what if the patient isn't ready for a referral? So here, awareness is key. So we know that people can get overwhelmed or anxious, or they're just simply not ready to receive our services. That's okay. Planting the seed is the important step here. So maybe just direct them onto our website so they can learn more about our services, and at least you've planted the seed, and when they're ready, we're here. What if funding? Funding is also a major concern. So for patients that are under 65, NDIS is usually the funding source. If it's over 65, then it's My Aged Care. Then there's also Department of Veterans Affairs, and there's chronic disease management plans from GPs as well. And for some services with Vision Australia, some clients, if it's if it's immediate needs clients and we assess that to be the case, then some of these clients might be able to access some specific services from Vision Australia via our donations and grants. What happens if a patient isn't eligible for funding? We have a team of experts that can assist with funding applications and gives access to certain services prior to funding as well. Like that library services I was talking about, that's completely free and that falls under a different government grant. I think, oh, all right, that's it. That's from me. Thank you for your time. Yes, please, if you have any questions, please reach out. Thank you.